If you take amlodipine, Losartan, or Lisinopril, there is one thing you need to know right now. Many seniors believe that as long as they take their medication every day, everything is fine. But the reality is, some side effects, warning signs, and medication mistakes often go unnoticed until a more serious problem develops. What's even more surprising, some symptoms that are often dismissed as a normal part of aging may actually be warning signals that should never be ignored. In the next few minutes, you'll learn what to watch for, what to avoid, and an important fact that very few blood pressure medication users know.
High blood pressure is often called the silent killer. Why? Because many people feel perfectly fine, even when their blood pressure is dangerously high. Unlike some health conditions that cause obvious symptoms, high blood pressure can quietly damage the body for years without causing any noticeable warning signs. In fact, many people do not realize they have high blood pressure until it is discovered during a routine checkup or after a serious health problem occurs. Over time, uncontrolled high blood pressure may place extra strain on the heart and blood vessels. This can increase the risk of heart attack, stroke, heart failure, kidney disease, vision problems, and damage to blood vessels throughout the body. The longer blood pressure remains elevated, the greater the potential damage may become. That's why doctors often prescribe medications such as Amlodipine, Losartan, or Lisinopril. These medications help lower blood pressure, which may reduce the risk of serious cardiovascular complications and help protect vital organs over the long term. For many people, these medications play an important role in maintaining overall health and reducing future health risks. However, taking the medication is only part of the equation. Understanding how the medication works, being aware of possible side effects, and knowing what changes to watch for can be just as important as taking the medication itself. The more informed you are about your treatment, the better prepared you may be to work with your healthcare provider and manage your blood pressure safely and effectively. Let's start with amlodipine. Amlodipine belongs to a group of medications called calcium channel blockers. It is one of the most commonly prescribed blood pressure medications in the world, and many older adults take it every day to help manage hypertension. Its primary job is to help relax and widen blood vessels. It does this by affecting the movement of calcium into certain cells within the heart and blood vessel walls. When blood vessels become more relaxed, blood can flow more easily through the body. As a result, blood pressure may decrease, and the heart may not have to work as hard to pump blood throughout the body. For some patients, amlodipine may also help improve blood flow to the heart, which is one reason it is sometimes prescribed for certain heart-related conditions as well. Many doctors prescribe amlodipine because it can be very effective, especially in older adults. It is often taken just once a day, and many people are able to use it successfully for years. But like all medications, it may also cause side effects. Some of the most common include swelling in the feet or ankles, flushing or a feeling of warmth in the face, fatigue, dizziness, headaches, or occasional heart palpitations. In many cases, these side effects are mild. However, they can sometimes become bothersome enough to affect daily activities. Many seniors notice ankle swelling and assume it is simply part of getting older. Others may think the swelling is related to standing too long or changes in circulation that naturally occur with age. But in some cases, the medication itself may be contributing to the problem. This type of swelling is often not dangerous, but it can be uncomfortable and should not be ignored. If swelling becomes significant, appears suddenly, or is accompanied by shortness of breath or other unusual symptoms, it is important to discuss it with your healthcare provider. Sometimes a dosage adjustment, a medication change, or further evaluation may be needed to determine the cause. The key point to remember is that any new symptom that develops after starting a medication deserves attention, even if it seems minor at first.
Next is Losartan. Losartan belongs to a group of medications known as ARBs, or angiotensin receptor blockers. It is one of the most commonly prescribed medications for high blood pressure and is often used by older adults because it is generally well tolerated. This medication works by blocking the effects of a hormone called angiotensin II. Under normal circumstances, angiotensin II causes blood vessels to tighten and narrow. When blood vessels become narrower, the heart must work harder to push blood through them, which can cause blood pressure to rise. Losartan helps block this process. When that hormone is blocked, blood vessels stay more relaxed, making it easier for blood to flow throughout the body. This may help lower blood pressure, reduce strain on the heart, and improve overall circulation. In some patients, Losartan may also help protect the kidneys, which is one reason doctors sometimes prescribe it for people with certain kidney-related conditions. Many people tolerate Losartan quite well. In fact, some patients who develop a persistent cough while taking an ACE inhibitor, such as Lisinopril, may be switched to Losartan because it is less likely to cause that particular side effect. However, like any medication, Losartan is not completely free of side effects. Some individuals may experience dizziness, fatigue, lightheadedness, changes in kidney function, or elevated potassium levels. Dizziness may be more noticeable when standing up quickly, especially during the first few weeks of treatment or after a dosage adjustment. This is because the medication may lower blood pressure effectively, and the body sometimes needs time to adapt. Another important consideration is potassium. Because potassium levels can sometimes rise, routine blood testing may be important for some patients. High potassium levels may not always cause obvious symptoms at first, which is why regular monitoring can be valuable. In more significant cases, elevated potassium may contribute to muscle weakness, fatigue, or changes in heart rhythm. Doctors may also monitor kidney function periodically, particularly in older adults or in patients who have diabetes, kidney disease, or other chronic health conditions. This is one reason regular follow-up appointments matter, even when you feel completely fine. Many people assume that feeling well means everything is working perfectly. However, blood pressure, kidney function, and potassium levels can sometimes change silently without causing noticeable symptoms. Regular checkups help ensure that Losartan continues to work safely and effectively while allowing your healthcare provider to identify potential issues before they become more serious.
Now let's talk about Lisinopril. Lisinopril belongs to a class of medications called ACE inhibitors, or angiotensin-converting enzyme inhibitors. It is one of the most widely prescribed medications for high blood pressure and has been used for many years to help reduce the risk of cardiovascular complications. Lisinopril works by reducing the production of a substance called angiotensin, a powerful hormone that causes blood vessels to narrow and tighten. When less of that substance is produced, blood vessels remain more open and relaxed, allowing blood to move more freely throughout the body. As a result, blood pressure may decrease, and the heart may not have to work as hard to circulate blood. In addition to treating high blood pressure, Lisinopril may be prescribed for certain people with heart failure or for individuals who have experienced a heart attack because it can help reduce stress on the cardiovascular system. Like Losartan, Lisinopril can be highly effective for blood pressure control. Many people take it successfully for years and experience significant benefits from treatment. However, one side effect stands out from the others: a persistent dry cough. This is one of the most well-known side effects associated with ACE inhibitors. Some people develop a cough that lasts for weeks, months, or even longer. The cough is usually dry, meaning it does not produce mucus, and it can occur during the day or at night. For some individuals, the cough may be mild and only slightly annoying. For others, it can become frequent enough to interfere with sleep, conversations, or daily activities. Because the cough often develops gradually, many people never suspect the medication. Instead, they may assume it is caused by allergies, a lingering cold, seasonal changes, or simply getting older. As a result, some people live with the symptom for months before realizing it may be medication-related. If a persistent cough develops after starting Lisinopril, it is important to discuss it with a healthcare provider rather than stopping the medication on your own. In some cases, an alternative medication may be considered. Other possible side effects may include dizziness, lightheadedness, elevated potassium levels, changes in kidney function, fatigue, or occasional headaches. Like Losartan, Lisinopril may sometimes increase potassium levels, which is why periodic blood testing may be recommended. Healthcare providers may also monitor kidney function to ensure the medication continues to be safe and effective over time. And, although it is uncommon, there is one rare side effect that deserves special attention: a serious allergic reaction called angioedema. This condition may cause sudden swelling of the face, lips, tongue, or throat. Because swelling in the throat can affect breathing, angioedema should always be treated as a medical emergency.
Fortunately, this reaction is rare, but knowing the warning signs can help ensure prompt medical attention if it ever occurs. The key takeaway is that lisinopril can be a highly effective medication for managing blood pressure, but understanding both its benefits and its potential side effects can help you use it more safely and confidently.
Now let's discuss warning signs. Most side effects associated with blood pressure medications are mild, and many people never experience serious problems. However, there are certain symptoms that should never be ignored. While serious reactions are uncommon, recognizing them early may help prevent potentially dangerous complications. Seek urgent medical care immediately if you experience swelling of the face, swelling of the lips, swelling of the tongue, swelling of the throat, or difficulty breathing. These symptoms may indicate angioedema, a rare but potentially dangerous reaction that can occur with certain blood pressure medications. Although angioedema is uncommon, it can become a medical emergency if swelling interferes with breathing. This is why immediate medical attention is important. You should also contact a healthcare professional promptly if you experience severe dizziness, fainting, unusual weakness, chest pain, rapid or irregular heartbeats, or significant changes in urination. For example, producing much less urine than usual, or noticing a sudden change in kidney function may require medical evaluation. These symptoms do not automatically mean that something serious is happening. In many cases, there may be a simple explanation. However, they can sometimes indicate that your blood pressure has become too low, that your medication may need adjustment, or that your body is responding differently to treatment. This is especially important for older adults. As we age, our bodies may become more sensitive to medications, and symptoms such as dizziness or lightheadedness can increase the risk of falls and injuries. Unfortunately, many seniors dismiss these symptoms as a normal part of aging and never mention them to their healthcare provider. The key message is simple. Pay attention to new or unusual symptoms. Don't assume every change is simply due to getting older. When something doesn't feel right, it is always better to ask questions and seek medical advice. Prompt evaluation may help identify problems early, allow treatment adjustments if necessary, and prevent more serious complications from developing later.
Now let's discuss one of the most important parts of this video: common medication mistakes. Even when a medication is prescribed correctly, small mistakes in how it is used can sometimes reduce its effectiveness or increase the risk of unwanted side effects. One mistake is stopping medication because blood pressure numbers have improved. Many people assume my blood pressure is normal now, so I probably don't need the medication anymore. But often, the medication is the reason blood pressure has improved in the first place. When treatment is working, blood pressure numbers may look normal because the medication is doing its job. Stopping suddenly without medical guidance may allow blood pressure to rise again, sometimes without causing any noticeable symptoms. And because high blood pressure is often called the silent killer, many people may not realize their numbers have increased until a serious health problem develops. Another common mistake is ignoring side effects. Some seniors assume dizziness, fatigue, swelling, or lightheadedness are simply signs of aging. Others may feel embarrassed to mention symptoms or worry that they are bothering their doctor. In reality, these symptoms may be related to medication, and treatment adjustments may sometimes be possible. A simple dosage change, a different medication, or additional monitoring may help improve comfort and safety. A third mistake is skipping follow-up appointments. Many people feel well and assume there is no reason to return for routine checkups. However, blood pressure medications sometimes require ongoing monitoring of kidney function, electrolytes, blood pressure trends, and overall treatment effectiveness. Some changes can occur gradually without causing obvious symptoms. Regular checkups allow healthcare providers to identify potential problems early before they become more serious. Another mistake some people make is missing doses or taking medication inconsistently. Blood pressure medications generally work best when taken exactly as prescribed. Skipping doses, taking extra doses, or changing the schedule without medical advice may make blood pressure more difficult to control. The most important thing to remember is that successful treatment involves more than simply taking a pill. It also involves staying informed, paying attention to how your body responds, and maintaining regular communication with your healthcare provider. Regular checkups help ensure that the medication continues to work safely, effectively, and in the way that best supports your long-term health. Here is the important fact many seniors never hear.
As we age, our bodies often process medications differently than they did years earlier. This is a natural part of aging, and it can happen even when you have been taking the same medication for years without any problems. Changes in kidney function, body composition, hydration status, liver function, and overall health may alter how medications affect the body. For example, older adults often have less muscle mass, different fluid balance, and changes in how quickly medications are absorbed and removed from the body. As a result, the same dose that worked perfectly in the past may affect your body differently today. This means a medication that worked perfectly 10 years ago may not affect you exactly the same way now. Some people may become more sensitive to certain side effects, while others may notice changes in how well the medication controls their blood pressure. This is one reason why healthcare providers often pay closer attention to medication management as people get older. It is also why regular monitoring becomes increasingly important with age. Unfortunately, many seniors assume that if they have been taking the same medication for years, there is no need to discuss it during routine appointments. But even long-term medications should be reviewed periodically. A person's health status can change over time. New medical conditions may develop, and additional medications may be added to a treatment plan. All of these factors can influence how the body responds to blood pressure medication. That does not mean the medication is bad, and it certainly does not mean you should stop taking it. In fact, for many people, these medications continue to provide important benefits for years or even decades. The key point is simply that medication management should evolve as your body changes. The goal is not only lowering blood pressure, but lowering it safely, effectively, and in a way that supports your overall health and quality of life. The most successful approach is often a partnership between you and your healthcare provider, with regular monitoring, open communication, and periodic reviews to ensure your treatment continues to meet your needs as you age.
Medication is important, but healthy lifestyle habits may also play a major role in supporting heart health. These habits may include eating a balanced diet, limiting excess sodium, staying physically active, maintaining a healthy weight, getting adequate sleep, managing stress, and avoiding tobacco products. Even small improvements performed consistently over time may help support overall cardiovascular health. Remember, healthy aging is rarely the result of one single decision. It is usually the result of many small choices repeated day after day. Amlodipine, Losartan, and Lisinopril have helped millions of people control high blood pressure and protect their long-term health. But remember, taking the medication is only part of the picture. Understanding how these medications affect your body, recognizing potential warning signs early, avoiding common medication mistakes, and staying informed about your health can make a significant difference as you get older. If you take one of these medications, or if someone you love does, take a moment today to review what you've learned in this video, and don't hesitate to discuss any concerns with your healthcare provider. And before you leave, make sure to click the like button, subscribe to the channel, and turn on notifications because we regularly share important health information that every senior should know. Most importantly, share this video with a friend, a spouse, a parent, or a family member who takes blood pressure medication. You never know who might benefit from this information, and one simple share could help someone recognize a warning sign they might otherwise ignore. Thank you for watching. Take care of your health, stay informed, and we'll see you in the next video.